When we see patients with shoulder pain, the first step is figuring out what's causing the pain. And some common issues that can create shoulder pain are rotator cuff, whether it's tendonitis or a tear, potentially even some arthritis in there. If it is a rotator cuff tear, there's different ways we can treat it. Sometimes it can be treated without surgery. Other times surgery is the right answer, and we will talk about that. Those patients that require the surgery, it's usually because the rotator cuff has been torn off the bone. The rotator cuff is really a collection of muscles and tendons that originate on the shoulder blade, and then they insert on the ball of that ball and socket joint. They really play a real dynamic process in moving your arm, especially above your head, away from your body. If those tendons are torn off the bone, and if they're still in a situation where they can be repaired, that's usually when we're going to talk surgery. The surgery for rotator cuff is an arthroscopic surgery. What does that mean? Well, it means that we are repairing or fixing the problems through small incisions. We use small tools and a camera that assists us with visualization to see. Our goal with a rotator cuff surgery is to restore the cuff or the tendon back to the bone, where it belongs. That's where it was meant to be. That's where it tore off. First, we need to mobilize or get that tendon more mobile so we can get it back to where it belongs. Oftentimes, it's been torn off the bone long enough that it can contract, and we got to get that freed up. Once we get that freed up, then we grab that tendon with heavy stitches. And those stitches then get anchored inside your bone, right where it needs to be. Those stitches are already attached to little anchors. Those little anchors are like screws that go inside the bone that hold the tendon down on top of the bone. You don't feel those anchors, you don't see those anchors. Some of those anchors you may see on x-ray if they have metal. Some of the anchors do not have metal and you won't be able to see on x-ray. It doesn't preclude your ability to fly, and it oftentimes isn't big enough metal to set off a metal detector.